So what happened was, yeah, because this hit your uniform, so now you're gonna. So just be very careful with that.
One Russian.
That's all right.
Two add some more teeth.
Yeah. So here, I'm just gonna have you come to this side a little bit, just because I don't want to get too close to that.
So like the surgeon would be like, why do you look like you don't know?
It looks like a Russian.
No, she's right. How you always know is this will be on the inside.
There you go. Okay. Retractors.
Retractor 1, 2.
And then you're gonna go right for gowns or gloves. As soon as you put that on, oh, you didn't get gloves.
Oh, it's in your pocket.
All right, Lily, I'm gonna reach around here.
Okay.
Sorry.
Okay.
There we go. That will happen a lot.
Gotcha.
I should have grabbed one, but I didn't even know about the
Forced it.
Almost like a rate.
Got it.
1 cent. Well, 2 cents actually.
Yep.
Full suction,
Yep.
2 pieces. 2 big double-ended Richardson.
Good.
And then 2 smaller ones, double-ended Richardson.
And then just a
Knife
little bit
handles.
lower, Sarah, so that she doesn't
Knife
have to go up like this, so that she can just go
Sandy,
right
do you
in.
want to add to the count? Suction? How many total suction do we have?
We have.
And then keep, nope,
We have
there.
1, 2
Yep,
pieces,
keep your
and then we
finger
have
back,
3
keep your
So
thumb
3
back.
in total,
3
right?
total.
That's
There
it.
you go.
I agree with that count. So you guys
Perfect.
want to set up, you guys remember how to set up for that appendix case or any in general? Or you did that. So up here,
I
set up
gave
some
it to
Mayo
you for your pack.
any way you want. Put some instruments up here, and then what we're going to do is drape the patient.
All right,
okay? I'll
guys,
come
go
in
for
with
it.
you, okay.
Okay.
So you guys can work together, put some stuff up there, a little variety of things, and then we're going to get there. I want to see it passing. I want to see some ties passing. I also want to see how you pass some instruments, okay? I'll give you a couple minutes to kind of work together on that.
Is this how you did yours different? Or did 2 towels?
Oh, yeah.
We will go. You guys
Sure,
get
she
your
has
Mayo
her
work together,
ties,
get your
so that's
Mayo
fine,
stand
yeah.
set up.
But I would have to move your ties out of there. But yeah, so that's fine. I'm just going to hold that real quick. So if you're asking me how I did it, so I like to just try to get the edges as best I can. You know, obviously try not to move stuff around as much. You know, once you commit to it, you stay. Because the more you move things, people freak out. Why is that? Because stuff flies around. You can contaminate more, right? I try to have that down as flat as I can. And if you had an extra blue towel with the ties, you could put the ties probably under there too if you want, but it's up to you. Oh, I don't like that at all. What happened there? Can you hold that for me? Sorry. Please, thanks. So typically I start off that way and then you can spin it.
Yes, if you put them on your Mayo, that you're ratcheted.
Right. So I got 4 bellies. Poker.
And if you had, this is your extra one, right? So you can do the ties into there. I would just, of course, this is all. You would not unwrap it.
I didn't see any.
So you have a little opening there, so you take your time.
So what I usually do is I do it a little bit thicker.
Try to
So
get it in.
what you want to do is you want to take it, and then I do it one more
Yeah,
fold.
scissors, you can kind of clean that up a little bit. But
I
if not,
usually
can
start at
just
this
close
end.
Yeah,
And I take off
but then I would just.
And you're not going to
what
want
you
all
can
these.
do
You're
is
going to want
have
those on
this-
your back table.
Let's see. Now you think about.
And you'll
what's
have
there
them
coming out of the
loaded back
field.
there.
And
just
then
a
I would
couple of
just have
them.
that, like, right
And then I
there.
usually
Some
start. So
doctors
how
don't
I
even
do it
but I also would
is you
label
want to
with the skin
go
marker. That was
this way.
obviously-
So turn them around. So flip them the other way. Yep, because you'll start with the Kellys before you'll
Take
get
it
the
off.
Cokers.
I want you guys to
And you're going to go
feel-
like this
that's
way
how I
because then
would
the
do it.
Kellys are the closest
You
to
don't-
you.
You do what you're comfortable.
So when you're standing at the field, and now they should
So
stay up
put
nice.
some stuff on that Mayo. In the future, I want to get you that set up for that open appendix. But make sure you just took it off the stringer and it's not on the towel roll, right? It's a hot mess. That's all I see. And I'm starting to lose, like, my eyes twitching a little bit. It's like, so you take it off the stringer, yeah, because it's going to go everywhere. You're not going to have any control of that whatsoever, right? I think we need to have a towel roll lesson.
Yeah, like this.
So get it on there, get organized, and start putting some things on the field. But here's a rule of thumb too. Whatever's on your towel roll, whatever you put on your mail, go kind of, if you want to get a small towel roll, do you need some more blue towels? That's for the squaring off, right?
So then the other thing is
So Brooke, go ahead and do
wanna
a
go
small.
in the order
You want me
that
to
you're
do a towel
going
roll
to
for you and show
place
you one
them.
more time?
So are you going to do, so,
The towels.
You wanna do it or
and
you
this, and then this.
nope, other way. You're going to go from the bottom.
Alright, I
You're going to
know
go from the
Oh, yeah, yeah.
yeah, so it'd be
So this.
that on top, towels in the middle.
I'm thinking of the way it goes on the patient.
Yep.
Yeah.
So you're going to do towels in the middle. So the 3/4
The
first.
3/4 first.
And then the towels, then there you go. So then that way, and that's how you do also your gown and gloves for the surgeon. Towel, gown, gloves.
That's good.
Then that way, you're always, and is that any needle holders you want to keep back there? You want to load your needles,
The
okay.
simple.
load your needle,
process.
your sutures back there
I mean,
in an order. So what do you think would be the first suture you would need?
What do you think? What does that mean in that statement? Like, unfair. No, I'm
doing
just
an
saying,
open app.
we're just doing a basic
Okay.
setup,
What do you-
right?
What do you think the first suture we're going to need?
Trio.
Right, we're learning
So
how to do that.
probably I'm guessing
So,
probably
just
like a
put variety
nylon
of
or a
things up here
proline.
that I'm asking
Because the
for you.
reason why is we're gonna be taking a stapler, okay, GIA stapler or a TA stapler, and we're gonna go across the
That's going to be
appendix.
life.
Okay,
Life doesn't
then we're
always
gonna
go in the
invert
direction
that
you go.
stump.
You have to
When we
pivot.
invert
The
that
concept's the
stump,
same.
then they're going to
Like, to be
suture it,
more
and so
comfortable
it's gonna
doing
be a
it the way
long
Chrissy said, count and
acting
stuff. Let's
suture.
go with
Okay,
Go with your,
so
what you're
that's
comfortable with.
so then
long
once
as
you
it's
do
organized.
that, then
all
what
I
do you
ask
think our next suture is gonna be? What is it? Vicryl? So probably a
So I'm gonna do
Vicryl,
a
correct.
small
Probably
little
through a
towel roll
Vicryl.
here,
Then
so
what do you
you
think you're
guys
going to need at that point?
figure
Then
that
we're going to go
little
through the
mess up
layers.
up
So they're going to
there.
probably do
You
Vicryl
can
a
start
couple
putting some
layers,
items
and then
here
they're going
on
to
the
probably
layout.
do the skin. What do you think they use
If
on
you're not
skin?
sure, I can let you know.
Starts with an M. Monochrome. That's always your skin suture. Then what they'll do is then they'll take some glue and they'll glue the incision. You'll wait for that to dry, and then you'll put a dressing on it. Okay? So that's what they do. And sometimes they don't even put a dressing on it once they glue it. They'll put a dressing on in post-op. So what you're going to want to do is you're going to want to get probably the Proline and the
It's
Vicryl
like,
loaded
that would be 52
and just kind of
pickup.
set them. And how I do it,
Great, what do you want?
You're
how you
fine.
want to do it. So you have your, where's
I
your
like to
needle
get
mat?
that
So needle mat goes
stabilized.
here.
So, yeah, make sure we have a good towel roll. Don't drop it on the floor.
Yep, so your needle mat goes there. This, once you make your labels and you've labeled everything, I
kick it
just
towards
tuck
me.
everything underneath here. Okay? So now when you get your needle loaded, I'll show you something.
The fish can.
Yep. Okay. What I usually do, now you're never going to use this small of needle.
Yeah, I'm telling you, this is
Okay.
a good example of the real world. I can
Okay.
either go really
And I
down
just kind of
real
leave
quick,
it sit like
or you're
this.
gonna
I mean, you will,
conquer
but not
this
an open
situation.
appendectomy. An open appendectomy. Now
I've
you
been
got
in
to
this
kind of have
scenario where
this
I
kind
feel
of
like I'm a hot
backwards.
mess and it just goes.
So
These are great learning experiences. Note
There.
to self: don't take off the stringer unless you're on a towel roll.
there you go.
Do you leave it on the
Yeah,
back?
I
I just leave it on the back
learn that.
table. That way
We
we're
don't use it till.
Because otherwise,
right
you go
until
through it,
later,
you're gonna
until
have
the
to try to
surgeon's
organize
ready. Okay. So
Yeah,
what
there
you're
you
probably
go.
going to want is you're probably going to want a couple
File.
DeBakey's over there, because you'll use the when you do make your incision, the surgeon might want DeBakey's after that. So there you go.
Is this it?
That's basically it. It's very, very
Doing
minimal.
great. Conquer.
I feel like when
And you get it done.
we did this final, I feel like I had so much more stuff.
Yep.
I did the final.
So and then you want to just
Okay, are these supposed to go under the towel?
yep. Here I'll show you how. No, it's not. So what you do is you just kind of take it. You're going to open it. Oh, these aren't towels. This is actually a suture.
Oh.
So we will.
I thought it was the ties.
Nope, that's actually a suture. But we'll get you some ties.
Don't be shy. Just keep going. Keep moving. Keep
Here we
moving
go.
through the process. Keep moving. You think you're not doing well, but you are.
Okay.
Can it be better?
So then what
Anything
you're
can
going
be
to do
better
is
in
you're
life.
going to take
At
this.
this point, we got to get going, get some stuff.
Now
done,
what I
get
do is I
organized
kind of
and
open
stuff.
it and I pull it out. When I do my towel,
It looked
when I
like
put
you
it
might
under
have
my
did my
towel,
first
I don't let it
estimate.
hang off initially.
I had like
So
one
how I do it
it was
is
pretty
I
simple.
take it. So before we would ever get that on there.
Yeah, I know. That's why I thought it was too late.
Nope, it's never too late. So I take it and I kind of just go like this. So this
TV knocked me out.
this way, that all I have to do when I get to my field is kind of reach under, take the curves, and pull them out.
Okay.
You don't want
because it'll be over the patient, so
it'll be sterile.
Yeah.
So
Okay,
then
that
I
makes
just kind of take my fingers, I go underneath, I grab
We're
the
almost there.
curves like this, and I just pull them out.
Before when I was doing it, it just felt so sketchy because I thought I was like
Yep,
gonna hit the
you
side
never-
or something.
Yep, you never do, but now it's all ready. So when you get up there, you just flip them out, and it takes 2
Great.
seconds.
So now we can. That's
So,
outstanding.
how do you think
job.
you did?
Perfect. So put
I
some
think
variety
I
of pins
definitely
up
need to
here.
work on
So
that.
what I used to
I
do
think it's more of
is
just
try
like
to
a
go in
refresh
conjunction
for
of what
me
your
'cause
towel roll
it
is.
feels
So
like so
let's
long.
just put
So the
one
other
of
thing
each
I'm gonna
item.
show
So
you
put a
is
towel roll or a
with
towel clamp right here, right?
appendectomy, you
And
might
you guys
have
can just
some
put a variety of things
oozy,
going
you
in
might
the
have
order
some
and
blood. So I'm
make
gonna
sure
show you
you're
how to
still
do
organized and you're not trashing as you go along.
what's it
'Cause
called?
otherwise, you're just gonna have to re-go.
Sponge stick.
So
Thank
the
you.
idea is organized.
So I
chaos.
take
You
it and I
keep this
fold
organized through the
the
process.
the
that
ends
final count's gonna be proper.
that
If
come
it's just
unfold.
everywhere, right,
I
it's
take it and
gonna
I
be hard to
create it
track
like
on
this.
anything again.
Then
I've
I
been
take
down that
this
road.
and go
It's just-
back
you're not
over it.
organized. It's just everywhere. And that
Okay.
count I did like 4 or 5 times. It's miserable. So the more
Then you
organized
just kind of
you
fold
are
it
in the
over.
process. And obviously your towel roll could be better, but we're not going to go down there.
Yeah. So I'm not gonna do any right now.
Just put a variety up here, and then maybe a
And there you
couple.
And now, if you
two
feel
Army
it,
Navies.
you can-
and a couple
it'll be a
forceps.
nice blunt dissection, but it's not going to hurt
Are
any
you okay, bro?
tissues. It's just gonna kind of rub them off. So
You just do one. And just
I just do one. yeah, and if I know I'm doing if I'm doing a vaginal case, I will do multiple. I won't do
So
just
just
one.
kind of put them in the
So
order.
anytime you're doing
That's
like a
in conjunction
like
of the
a
same order on
hysteroscope,
that
you're gonna
string
want
on the
both
back.
of them loaded because they're gonna go in there and they're gonna rub the cervix and they're gonna make sure that they're grabbing the cervix, finding the os, which is where they need to put the dilators into, and the Sims uterine sound. So they got to go through, measure the uterus. So you're going to use multiple of these for that. So, but otherwise,
Good.
this is why we do it. It's all practice.
Okay, so put a
Practice,
variety.
practice,
Yeah,
practice, and practice and working
So
together.
it's your maid. You're
That's the
comfortable.
key.
Put some things up.
So, loading
Start
this,
thinking about this. So
you're going to squeeze it.
that's probably
We did put a lot.
in my
No, you
experience.
didn't.
More general cases is used at the very end.
Never
So
go
it's
like
probably not
this.
So this
and
is your home base.
Flushes. You're going
And
to
this
tip
is
it
your
back
thing that
up,
you're kind of putting stuff
and
up.
you're
and
going
you
to
can
do it
always
again.
put stuff up here.
Because
and
the
take
reason
stuff back.
why, if you
So
do
is
that,
it
you're gonna
better to
squirt a
start off
surgeon
with
in the
1,000 things? Let's say you have no idea what he needs. Is it better to start off simple?
They're
and
not
then
going to
start
be
adding as
happy.
you go along?
The other thing is if you ever
Once you
put
get
any
used to
fluid
it.
in, if
Yeah,
you
otherwise,
do put
so keep
saline
it
in
simple.
here,
You got
you
a
know you're
variety
going
of things
you
up
have to
here,
label it.
scissors,
Okay?
no traction, right?
But
You gotta
otherwise,
start off.
you labeled
You have to
good.
make an incision.
You've got
you
a
gotta
good
probe, we
idea
have some
on how to
retraction
set this
devices,
up.
Right?
Yeah.
You have a
What
good
about
idea
sutures? Do we have
here.
some sutures ready to go? Now,
You're
can I just
probably,
change this?
you might need
Just
these.
this here,
I
I
would have,
typically want to
see
scoot
here,
it
you
back.
don't have those in here.
And
But
if you have
otherwise,
your
well, yeah, you do have these
laps,
too.
so you don't need
I
all
would have-
your rate
I would
I'm
have
sorry,
started
all your
with
rate
these.
techs up here. So
And
just
then
maybe one,
went,
and then put the rest back.
and if I
Twice.
needed
The
to,
odds of you
then
using 10 all at once
then
is
did it.
1
So I would have
You
taken
can always get more.
I take my
But have a
malleables and
one
just kind
and
of
he goes
stick them
to
in
a
the
lap
back.
'cause he's deeper in.
Now you have
Switch over
access
a lap,
to
right?
everything.
I would have a suture
need.
always
Your pool,
preloaded. This is an
eh,
extra one.
You don't put
So
it
have
together.
that
No,
loaded up.
unless
Load
I
that
know I'm
suture
gonna
up and
use
have
it.
just sitting
Because
right there.
otherwise, my biggest thing is I
So
forget.
here's a rule of thumb: you don't
I
have
don't want to
to.
forget to take it
If you're ever
apart. So unless
confused
I know
about
I'm
where
going to use
goes
it,
on the
I have it
needle,
already.
it's right
there.
Now, Chrissy showed you there, but you don't
But this
have
is,
to move
you know,
it.
this
It's
is
right
the thing.
there.
Have your
So go ahead and do it.
your
So it always starts
traumatic
at that 2/8
graspers
of
here.
that
Have your
needle.
atraumatic here. So,
But
and
the
I
needles
kind
are
of.
designed to be
Yep,
right where it's
that's what I
supposed to
usually do is do my
Just clip
my
right
traumatic
onto it.
ones,
It
which
should be
anything
right
with
on,
teeth
directly where
are
it should
considered
go.
traumatic,
Now,
and
unless the
anything
surgeon
without
says, you know
teeth
what, I
are
like
not.
it this way. And
So
you
your
can-
Russians, your
So here's what I would do.
DeBakey's, smooth ads, and
Yeah.
smooth tissue forceps, your atraumatic.
This is for.
It's perfect.
That is if they take
so
out
then I
a
would just
specimen.
have this.
They might
preloaded,
measure it
ready to
because
go.
they need to know the margins.
Just be very
The other
careful.
thing what they
That's-
might use it
yeah.
for is to measure
Try
incision.
to get that
Sometimes,
into
if we're
it.
doing a
It's
specific
protected.
type of dressing, they
So-
might need to measure.
So you're
that
ready to
incision.
go. So if the doctor ever needs the
What?
suture, you always have something preloaded.
What's what?
Knock myself out.
This? Oh, he's listening to me talk.
Any questions?
See?
I'm not trying to overwhelm you, but I
What
am a
came
little
up
bit
with
trying
the-
to.
I don't
I
worry
think
about it.
I think you
We'll
guys
get you a
did
new one.
fine. Now the
I
key
think it'll
is what's
still-
comfortable
it's
for
on
you. Speed.
one
And
more
what you're
new one.
saying, your feeling of like.
But anyway.
as a student, I felt like I didn't know what the hell I was doing.
Well,
That's
ask
a
Brad
normal
what he wants you to do next.
So that's why I tried. I wish someone told me
So-
keep it simple. if you can master the simple things, get to the field, start setting up, get a mail ready to go, gather your counts, get the count done, and that's half the battle.
It is different.
Everything is a little bit about trying to get that routine. Anyways, how do you guys
Do you
do?
want me to start
So-
stuff back up?
So what I want to do is also, before you go, I want to have everyone, so we're going to use their setup. We're going to drape the patient.
Okay.
So we'll have these two young ladies drape, and you guys can watch. But eventually I want everyone up at the field. A doctor's going to come in, and what I want you guys to do is always introduce yourself. I know that sounds corny. I'll give you an example. Good morning, doctor. I'm Brad. I'm a surgical tech student. Nice to meet you. Very simple. So he knows. It's a great, not just, it's a little awkward, right? Doctor's walking around. Who's the student in front of me? It really just it just lets them know what's going on, and it's a proper way to do it. That's why I was always trained, right?
I know, I just
Did you just did it?
Yeah, I just touched everything. Everything was like,
Get out.
sorry.
So what
The
I
other
want
thing
you
is,
to, Brooke and Karina, I
Even
want
if
you.
they do know you,
Yeah.
always say good morning.
Yeah.
Always
Yeah.
say, hey, good morning, how's it going?
Take it back. I'm sorry, since I already messed up.
So the correct, if you have some concern, come to a nurse. Say, can you fix my mask?
So that's the thing. Always say good morning, even if you've worked with them before.
Okay.
Just say good
What's your
morning, how's it day? How you doing, or something
nose
like
itch?
that.
Yeah,
Scratch
And then Lily.
That's why I kind of like pulled it down without even thinking about it. Mercy caught me in the action.
The white part.
So you
How
guys
you get
cool?
used to it?
Yeah,
You just get-
irritates my hand. Oh, the cough. Yeah.
So what's the most valuable part of anything we just did today? You think? Just listen, right? Respond appropriately. Preceptors are going to have 1,000 ideas about what's that.
I was saying if I could do that or not.
No, because you
Do
just pulled your cuff out of your glove.
Yeah.
You can't.
So there's a variety of things that they're going to be shown. So you have to just kind of adapt to different perspectives, and it's how you respond. And are you going to get frustrated and you want to like bite your lip? Answer is yes. You probably will, but you better as a student just kind of go with it. Yes, ma'am. Yes, sir. Yes, doctor. When you come here at our prep class, we can vent together, but don't do it out there. Really.
I'm just scared that I'm not gonna know what I'm doing.
So that's a
and
good question.
they're
So.
gonna think I'm stupid.
Well, the doctors probably will do that anyways, but that's just some doctors. But my point is that comes with time.
Mhm.
So that's why I kept saying keep it simple right now. Can you get to the field? Can you gather yourself? Can you do a count? Do you know basic instruments? Can you help drape? Can you pass properly? I mean, it's not like something we have not shown you. Everything else will come with time in a sense of trying to show you more extensive things.
And I will tell you, it doesn't matter if you've been doing this 5 or 10 years or 20 years. If you meet a new surgeon, they are not going to trust you until they see what you can do. So don't go into any place thinking a surgeon's going to trust you. They're not going to. So you got to go in there, prove to them what you can do, but they know you're a student. Don't question what they're doing. Don't question what they're asking. Just say, okay, that is the best thing you can do.
And you're going to learn that way.
Yep.
I'm nervous for the first day.
That feeling that you have is everyone's feeling.
Everyone's.
I wasn't shown enough. I got it. I perfectly understand. There's a lot of information. Did I comprehend? You feel a little dumb. I got it. It's all normal. But how are you going to just plow through it? It's progressively. I guarantee you come back on your 15th knee case, I'm pretty sure you got a little gist of it by then. Come back with your 100th one, you're probably training people now. It takes time. It doesn't come overnight. It didn't take me. I mean, it took me a year before I could say to myself, I wasn't sweating going in certain cases. And I still do because I don't do it all the time. And trust me, if I went in now, it's been a while. But
Yeah.
my point is, it takes time.
It's all, I mean, and the thing is, you should be learning every
I
single
don't know
day.
what you're saying.
Every day you should be learning. And I don't care, if, like I said, 20
So
years.
we're going to drape.
Take this off and
So
I wish
So what-
that you could be my preceptor.
I wish we can go out. So what's the first thing? You came a little too close. Be careful. It's the same premise, right? We got to keep at least 12 inches. Otherwise, you're out the wall. So somebody used to tell me, keep your ass out. And that sounds crazy. Who has a big ass nowadays? Not Janet Jackson. Cardi B now. Get your Cardi B out, right? So that means when you're coming out, you're coming out like that, right? Get your- It is true, right? So by the book, we train you to do a down sheet first and square off the whatever incisional side. We're going to do this thing here. So we prepped around and then put the drape on. And doctors sometimes would do it differently. Like Dr. Patel, he squared off first and then put a down sheet. It is a variety of things, but by the book, we're going to do that today. Okay, so now there's two ways. I want to see how you did it. How do you guys normally do it? Because
Like,
I was always trying to kind of go like this across, but or one of you are going to hold it here and you get the end and come out like Dr. Patel did. What do you think is the best bet?
Cross.
So I'll let you guys do that. So you're going to come on this side, right?
But like again, you're gonna find surgeon preference. No, don't let that drop too low. Remember.
Just let them think it's. So yep. And I guess we're going to go with Cardi B. And if I see you get, see it, to me that's a little close. I've had an orthopedic guy who would freak out. And you kind of back up, but be aware of your back too, about your field. I know that's you have to be. It's fine. It's this here is going to be against the bottom. So kind of similar concept. You still cup, go to the end. The whole idea is to cover the toes, right, and then get to where the here as close as you can. But if you can't, you just have to commit to it, right, and drop it. Perfect. So here's a good thing. If you somehow, let's see how that's exposed. Can't move that, right? Just put some blue towels, right? Yeah, just leave it alone. It's not good to move things around and go towards the incisional site. Just commit to that. And if it's something that's exposed, you got blue towels, right? If you're not, you're going to be squaring off this area anyways. You can always re-square off, recover something if it's... No, you can't. So what I want you to do is, you have your 4 towels.
Yeah.
So I want you to have them all 4 ready to go in your hand. So let's say you're going to play the doctor. So come over here and start going over here and squaring off, right?
put your finger behind one of the toes. Yeah.
Good job. So by the book is, you always want to do the one closest to you. Again, doctors, but that's just the way I would, at least I read that book. Reason is also you're, right away you're getting a barrier in between you. Again, it's, yes, so here, I'm going to show you real quick. You're fine. But it's kind of like cupping your hands under and then coming in. So God forbid if your hand's like that, you're going to be accidentally touching something. So kind of cup your hands under and try not.
So like this.
Go around the other way. So your hands are not on this side, your fingers are on that side.
Okay.
That makes sense? I'm going to let you think that through. Okay, that looks good. And just come in. Let's say that is the prep area. You want to come in here as close as you can. And just get in there now. Good. So here's the thing. You can't push it towards the field, but you can tuck it in a little bit here like that away.
Okay.
And you're fine. Just, and then continue on. Now, in the real world, a doctor is probably doing this as a student or some assist, but eventually you will do this. You know, some doctors will anticipate you to drape the patient before he comes in. And you will help with the preceptor, but as a student, maybe in the beginning you won't, but some sites probably will frown upon you doing this, but some will let you do it, depending on where you're at. But as
a student, that is.
Nurses do this?
No.
No, nurses aren't scrubbed in.
As a student, you won't probably do this, but when you get once you're an employee and you've been doing it for a while, they're going to have you drape.
You do it with the surgeon?
Yeah, usually.
Yeah. Most surgeons probably will, but in my opinion, some are in another. Because what happens, Sarah? They're in another room, finishing up, and they want this patient to come in, and all they want to do is come in and scrub it and start. So they expect some experienced people to do that.
Are we taking the tape off on these?
So that's a good question. So I'll verify. In this case, let's leave it on because we probably want to reuse the drape. So try to get down to this slice.
Yep, set it down onto it.
And then open up, right?
Watch your hand, Kareen. You can't put it underneath. Don't put it underneath. There you go. Don't move it though. Guys, be careful.
Sorry, Lily. No worries, Lily. I'm just trying to play stupid anesthesia.
Did you just say that?
So good, yeah. Cup while you're cupping your hands, because you never know there's a Neptune down there and you might hit it, right? Always protect yourself. And then come to the field here and protect your hand that way. There's a little part that you can come out, that's because if they have your legs or your arms extended. Good. So this is the point. Yeah, I'll go over that a little bit later. There is an extension, like I said, sometimes when you're in supine, your arms are out. And the arms are in. There's a part on this kind of drape that you extend outwards when the arms are extended, and that helps. Because believe it or not, if you don't do that, they'll have the fingers hanging out, and doctors freak out when they start seeing fingers. Like, they just throw a blue towel over it. So right now, that was pretty good. So we can throw that away. Do we have? All right, I can see something. So what's your instinct now, Brooke? I'm just trying to think. What do you think you have to do right now? Very good. So again, simple stuff, right? So when you see this, you got the drape on, you need to be doing something. So if this is your field, I want to be comfortable. Get it up to the field. So don't stop. I'd rather a preceptor say to you, hey, Brooks, let's just wait a minute, opposed to, why are you just standing there? So, you know, again, don't do anything out of normal, but this is a normal thing. Let's start pulling stuff up. How can you start helping? Right. Start pulling things around, start passing them off, right? There you go. You got it. So it's all a team effort. Now, I'm looking at you how you're doing that. That's Jacob. There you go. Put your hands above. I'm just as guilty as putting my hands below, but I'm trying to teach you good habits. So. I have a 400-pound ortho table. Last thing I want to do is do this, but I would always get yelled at.
That's what we got to teach you to do.
Good job. So the only thing I don't see is light handles. Now, I'm just going to, obviously this needs a little work, but I'm just curious, because I was never trained, why is this here?
It's supposed to be a little bit more.
So I always think about like an L situation. So this is yours, right? And let's say the doctor was going to be on that side, and you're going to be here. Is this comfortable passing the doctor? Yeah. So just think about it. You would have to go like this. So to me, I would go like put my tray just kind of like this, where I'm kind of having this scenario where I can still go like this, right? Now, would you think this needs to be over here? So those are things I start thinking about.
So with that, the
Go ahead.
reason why. So
I'm just curious.
no, I'm just going to show you what
'cause I
why
like
I
to
was
learn too.
Okay, so the reason why is I usually put it right here. I have everything there. What we were taught was if you have the L, especially as students,
Yeah.
their back is to the field too close,
Okay.
and they're running into the field. That's what
Okay.
we noticed when we had students when I was precepting
Sure.
students.
Sure.
So when we taught it like this. You stand right here. You have all your stuff. That goes on the side over there. Because remember, all that stuff's going to be coming up.
Gotcha.
So literally, you're standing right here, and everything is literally right at your fingertips.
Yes, ma'am.
But you do the way you want to. I was just saying the reason.
I was curious. I
Yeah.
like to learn things.
That's-
To me, it was not normal.
not go all the way over like this,
I got it.
but right here at the
So in
edge.
theory, you still have access to this. You're not turning your back. It makes perfect sense.
Yeah. So that's the only reason.
So it's a good example of, did I take it personal because I never saw that? No. I said, you know what? I'm going to learn from it. What would you like me to, let's say if I was, what would you like me to do? And that's fine. I would do it that way. You get hired. Obviously, if you're using proper aseptic technique and not turning your back to it, it's up to you how you design it.
But that's where, he
Yeah.
was trained one way. I was trained
Yeah.
another way. But you got to be open to new
Yeah,
things. Both
that's
of us. I mean, he's taught me things that I didn't know before. What?
Not much. I didn't teach you.
He has. It's stuff I've seen I didn't know. And there were certain things like the 3/4 drape in Minnesota. We never used
I
it.
need some light handles.
So I never knew that it was existed. So he's like, oh, we got to do this. I'm like, oh, okay. You don't take offense to it because you're going to learn all these different ways and all these new things. And it's going to be amazing because then eventually you're
What are
going
we
to
all doing
create it
here?
the way you want it to be. So
Are you guys done?
take it all in. Do what you want to do with it. If it's not, but do it. Remember what I said. Why do we do it the way
we're
the
going to get into
preceptor
a point
wants
where
you
we're
to
going
do
to
it?
start passing. But I want everyone to come in here. I want everyone to kind of try it out.
Right. Why? Why? What is the... Hey, guys, listen. What is the reason why? What is the reason why we do it the way
You're
the
not
preceptor
crazy. I
wants us
didn't
to
print
do
it
it?
out because I didn't have time yesterday. I'll get it to you next week.
Correct. And why do they need it that way?
But I'll
Very
get you
good.
one.
That's exactly why.
There's a video.
So the
there's a
reason
video on
why
it, too.
you set up the way your preceptor
I
wants you
was
to set
going to
up
print it yesterday,
is
but I
in
got
case
caught.
you got it's a fan. They've got to be able to jump in and they have to be able to know where
I'm so
everything
ready for
is.
vacation.
So that's the reason. It's not like they're telling you.
What do you do? Or what do we do as a student? It's
We're just going to ask you to step back.
back off.
Yep. We're going to literally say, okay, you need to step back at this point in time. We've got this.
So whoever's not doing
So-
a homework assignment and they're done with that, come on in here. We're going to watch a little
That
bit
is
about passing.
that is the reason why.
And I want
It's
everyone to
because
try it.
it's not
Even though if you're not scripted,
just
I
drop
still want you
it,
to try.
just drop it. Yeah. That is the reason why. It's not because we don't want to know, see what you got, to see what you guys do, but we want to see they have to be able to jump in if something were to happen.
My preceptor tell me where to put everything because I feel like I'll be so nervous I'll forget where you told me to put everything.
So initially they're going to help you, but after a few times working with them, you're going to know and you're just going to do it. That is the whole learning process. Is following what your preceptor. But take what Brad has taught you, take what I've taught you, take what your preceptors teach you, and move and work with that. Okay.
Yeah, you need to be open-minded.
Oh, be very, very open-minded, and don't ever say, "Well, that isn't the way I was taught," because you know what? They could be coming from the East Coast, the West Coast, the Midwest, anything like that, and they have just a little bit of variety of what they do. But look at it, learn from it. There's nothing wrong with it, long as it doesn't affect what the surgeon wants you to do, what the hospital policy is, or puts the patient in danger.
No, there's two.
Okay.
Same one, there's two.
No,
You have two on there.
You can take them out. Take them out.
Okay, that's what I want.
Yes, ma'am. I'm just trying to use my own words. I'm reading your mind, but it's hard. All right, so we're just going to go over here. I want everyone, eventually I'm going to have people rotate and just, Chrissy, you want to play the doctor?
Uh-huh.
What we're going to do is just get to the field and just do some passing and some suture passing, whatever you want to do. It's up to you. And then everyone can kind of go through that. Can I keep that on?
Oh, yeah.
I just want to hear you talking.
Sure you do.
Who's hot? We're all nice and cool. We're good. So again, Brooke, Doreen, you're the assist. You guys will rotate, but who's going to gown the doctor? So establish who that's going to be. Do we have a 6.5 glove?
No.
Can we grab yours? Do you have a 6.5? No?
I don't. I already all the ones I want.
Let's get who can run and get a 6.5 for the doctor because they're coming soon.
Do we have a gown?
Do we have a gown for the doctor?
Because I think we all use them as.
No.
You have one on your field, Sarah.
We have a gown. We just need
Sarah.
a 6.5. Okay.
I can gown.
So again, Karina, are you going to gown the doctor coming in? Just make sure you have that and anticipate that doctor coming in, right? And the first thing you should verify sometimes, are they wet? You'll see dripping. Obviously, if they're dripping, what should you have?
Towel.
You should have a towel, right? In this case, she's probably not, okay? But so just how do you get that through the field? Very carefully. Everyone's in suspense. So go ahead. Hey, went in. Don't get upset. Pick it up. Let's do it again. In this case, just pick it up, put it in the package, and let her grab it because I got to get going here. Corinne, could you grab that for her? Thank you. Merci beaucoup. All right. Doctor's coming in. So are you going to do it, Sarah?
Yeah.
Oh, it's Sarah again. Okay. Doctor.
Actually, it should not be like standing like that.
Very good.
Hello.
Hi.
Good morning.
Can somebody try the doctor?
So, I don't know who you are. Who are you?
I'm Sarah. I'm a student.
Hello, Sarah. Very nice to meet you.
No one wants to say student.
No, I know. That's the key. Because then they're like, oh, gosh.
I wouldn't be doing this as a student, right?
Yeah, you
Yes,
would.
you will.
Oh, yeah, you will.
Oh gosh.
I would advise you doing this as many times as possible.
Oh, gosh.
And anything that scares you, go towards the light.
Go towards the...
I'm telling you right now, conquer that fear. Don't.
Is that okay?
Yeah.
That was perfect. Doctor's coming in, so you can go on. Yeah. Wow. So the whole idea, I want you just to get used to. She's going to ask for some things, and just make sure you're handing that properly to her. Okay, this is yours. I want you to own it. Okay.
Mm-hmm.
Sorry, yours. Just assume you had.
So
some
get over there.
information.
Stand right there.
That's your-
Okay. What do we do first?
Marker.
Nope. What do we do first?
Time out.
Time out. Okay. Everybody stops. So, all right. We have a circulator. Says they're apart. We
Would
have...
you like me to do a timeout?
Yeah. Let's do a timeout.
This is John Smith. He's having an open appendix surgery, has no allergies, has 2 grams of Ancept. What kind of medication do we have, surgical tech, Brooke?
1% xylocaine with epi.
Does everyone agree? I agree with that. Does everyone know each other?
Hi, I'm Brooke, a
Good.
student.
Nice to meet you. Does everyone agree?
Great.
Yeah.
All right. All right. And then at that point, you'd say what you need to say, anesthesia, and then the surgeon would say what they need to say. Okay. Then what do they need next? Marker. So they would mark their incision site. What's next? There you go. What is it?
Inject them with xylocaine 1% a week.
Okay. So get the next thing ready. Set it right back on your field. You can always cap it once you hand the blade. There you go. Okay, get the next thing ready. What's the next thing?
Forceps.
Nope.
Forceps.
Nope. What do you need next? You need tissue forceps. Where's your tissue forceps? So give me a debakey. Tissue, Brooke, Brooke, tissue forceps, my dear. On the tray.
The tweezer.
I'll be like a rep and be like,
No, I know what it is.
yes, ma'am.
There you go. There you go. Now they're gonna hold it. They're gonna
Doing
then
really
you
good.
would hand the bovie because then they're gonna make their incision a little bit deeper. I'm not left-handed, so this is very difficult. Okay. Now you're gonna hand that back. Then you're gonna ask for a retractor.
If you see the light, make sure they have the light so you
Okay.
can control this.
So you're gonna put the
Make sure light's
retractor in. I'll take a second one. So you want to hold that, Lily? Perfect. Okay. Now they're going deeper. So okay, I need a tissue forceps. There you go. Kelly. Okay. Remember, you always want to put these on your male, ratcheted. Okay. Kelly. Lily, I'll have you grab that. Okay. Suture. Now I'm not a first assist, so don't laugh at me. What? Here, you can hold this one for me. I'm just asking for things. So how would you do that? Remember? Up. Up. Hold it up. There. See, now you're going to place them into their hand that they're going to use. They're not going to have to adjust.
Do you take it out of that thing or no?
Yep, you can take it out. Now grab it with this hand and then lay it on the field. There. That way it's going to be in control. Okay? So if they're suturing, what is the next thing they're going to need?
Scissors.
Scissors. Yep. Clamp, clamp, cut, tie. So, and like I said, this is not my forte. Brad should be in here doing this. All right, now. All right. Cut it right there. Yep. Okay, then they're going to hand you the needle back, and then they're going to, when they do that, you're going to ask for a clamp. Can I have a Kelly?
I feel like you should be a surgeon.
Me? Oh, thought about it one point in time. Now I'm too old. So, all right, and then you're going to hold this. Basically, you're going to just use it as a retractor. Okay, now, what next, Brad?
So, perfect, right? We're passing. Go ahead and I like to do what I call a speed test. And we're going to rotate out here real quick. So, whatever's on your mayo, take a quick glance, Brooke. And then quickly, the doctor is just going to constantly ask for it. But what I want you to do is, here, can I just show real quick?
Yeah,
Because
go for it.
This was what someone showed me before, and it's a good example of, it's fun also. So you can take those off. So whatever you give me, I'm going to clamp, and you're going to hold onto it with your left, and I'll give you another one and clamp with your right. But when I say take it off, you take it off with one hand, because you have to have the ability to use both hands. So, and that's always hard. So if I say take it off, I want you to do is just throw it down. I won't do it like that, but just throw it down. So your job is to keep an organized chaos. So wherever that is, you put that on your sharps box. And we're done with that blade. You can put that back. If you're done with something, just kind of put it back. We have already made incisions. Just start putting stuff on your back table. And then quickly organize that little stringer, and then we're going to go through this routine real quick. And eventually I want everyone to do that. And when you pass it, obviously it needs to be clamped, and you make sure you get it firmly in the hand. And then I'll correct you if I see it. And it's just a good approach. A good kind of, make sure the doctor's feeling it right, unless you're a neurosurgeon.
No, they're not.
It doesn't really matter. As long as you know what the instrument is, and I'm going to let you know. But wherever it's going to live, and if they throw it back on here, Brooke, make sure you put it right back where it originally started. It really is a good kind of philosophy to keep. You tell me when you're ready.
Me.
All you got to do is just listen to the doctor. Brooke, all right, can I get a hemostat? It's right. So that's right. So this is straight. So here, right, I'm just going to show you a little thing. So hold your hand out. Tell me which one's better and what do you think it feels better. This or, yeah, so if you have it, just right, hold your hand out. Right. So they feel like you're there. Because what this is like, you're down.
And a lot of times they're looking down.
You're right, and they're looking down, right? So straight hemostat there, or good. So hold that with your hand. Hold that out. Can I get another one? So just also when you're doing that, just say, "Come on your way, doctor." So let them know that you heard them, or she. Otherwise, they're going to say, "Did anyone hear me?"
There's one boy that.
That's my traction one. So can I just get a curved one to be okay? So a good rule of thumb is if you don't have it, say, "Doctor, I only have curved." And then yell out to the nurse, "Can I get a straight hemostat?" All right, so hold that up. Can I get a Babcock? Good. Take that off. Can I get a Coker? Take this off. Can I get an Alice? Good. Take that off. Good. Can I get a sponge forcep? Take that off. Can I get an Alice? All right, we'll stop. Take all those off. So what I want you to do is, did a great job. It's perfect. So let me just say, that's hard. It's a hard approach, right? It's a lot going on. But we need to start, this is great. You had your team kind of helping you out there. Now let's start doing a final count. And if I look back there, you think that's going to be fun to count? So I guess what we have to start as you're at externship, have an approach of organized chaos like that. Let's switch a little bit. You come up here, Brooke, and then eventually we'll get you on that side too, okay? And I want everyone to at least try to kind of go through that a little bit. We'll do it really quickly here. But keep this as organized.
cool.
But for just for this, I like to get those blades in the back so I don't hurt myself. Huh. Oh, hi. So as soon as I'll give you a couple seconds, and then we're going to go with it. And then we'll probably go through a couple of VN, and we'll start breaking down. What time is it, Chrissy?
3s.
What time is it, guys? Good. All right. Get a Babcock.
Correct. Yep. So they go in January.
So
They'll
make
go on
sure these are
extras in January.
here. I'm going to show you what it feels like. Right. Oh, Jesus. Good. Babcock. So hold that.
Yeah. We
Coker?
took out this wall, and then we took out the wall in the classroom
Okay.
to make a
So
larger
it's just,
classroom.
you ever hear what's that saying? Dangle. It's just kind of dangling there, right? Just kind of dangling. Right. It's kind of going there.
It's not working in the closet, huh?
Yeah. It was
Yep.
good. Okay, hold that
She
one.
was here when it was clear.
Alice.
So
Take
she
that off.
were here when Brad was here? Okay.
She's practically
Okay.
How do you take them off?
Yeah, just, so you kind of do this, and you're just kind of pinching up on it like this.
I can rotate it, not mess the.
Well, it's fine. If you're like this, you're just trying to take it off, just take it off like that. But reason is you have to use both hands in a sense, because you could be holding a retractor with one, and the doctor says another one. They say take it off. You can't let go of something, so you have to have the ability to use both hands. That comes with time now. Fine. So hold that just like that. Can I get a Babcock?
Don't go anywhere then.
Take that out with that hand. Hold that.
No, we
Can I get a Coker?
No, we need to talk.
So I want to hear "Coming Your Way, Doctor."
Coming your way, doctor.
There you go. Because otherwise, I'm like, am I the only one working here? Yes, you are, Doctor. That's why you're here. Put that up. Can I get a mosquito, hemostat, cryo, something like that, curved? Good. Take that off. Can I get a Coker? Keeping it as organized as possible. Take that off.
Yes, coming in place.
It's hard, isn't it?
Yeah.
Good. So what do I do? Give me a suture. Got a suture available? No, we cut it, right? All right. So switch. I want to see Corinne over here. You can stay here, Brooke, if you want. All right. Corinne's going to come over here. Brooke can stay up here. Sarah, do you want to get a little try too? next time. When she's done, we'll give it a little bit of a try.
You're
This is your field. Again, those blades, can we put them down by the sharps? I just don't want anyone to get stabbed. So again, rule of thumb is if you do an incision and we're past that, get it off your mayo. Because as soon as you have your hand on the mayo, for some reason you look up and there's 11 blades just sticking out of your hand, your day's over and you got to do a drug test. Which is one way to get out of cough. No, I'm just joking. I never thought of that. Trust me.
Neither did I.
It's like the old platoon is stab yourself in the leg. Get out of this room. All right, hemostat.
Get sent home.
Hemostat. So again, Kelly, hemostat. So again, they call a lot of things out in the world, right? Just verify. Coming your way, doctor. So he knows that you're, because he's looking down. Hemostat is just quiet all of a sudden. So dangle. Make sure it's clamped once. It's kind of broke, but hold your hand out. Kind of feel it there, right? All right, I need to work on that a little bit. Hold that real quick. Coker. Oh, you felt like this is how it felt to me. Watch. That's how it felt. Whoa. Yeah. Because doctors, ortho guys, they want to feel this, right? Because they're looking down, right? So let's say you're looking down. Hold your hand out, right? Are you doing a pee-pee dance? All right, just make it. Hold your hand out, right? Good, right? Coker. Hold that up just like that. So if a doctor says, hold that there, don't move. Hold that up. And we would love taking it off there. Give me a Babcock. Take that off if you can. Perfect. Okay. Buck. So it's just kind of, again, all these up there should have been like one clamp, right? And then you're good to go. So if something comes back, kind of thing, when you get it back real quick, just clamp it, put it right back up. So you don't have to think about it anymore. But that should be a kind of a thing. Anal retentive, but that's just the way it is, right? Hold your hand out. Right, good. Babcock. All right, good. Take that out. Can I have a scissors? Straight mayo. Good.
Clip that one.
Can I get a medicine bomb? Alright, good. What time is it? Suture? We have no suture.
No suture.
We don't have time for everyone to go through it, but the one thing I want you to get out of this is clamp these down at least once. Make sure you're giving it firmly in their hand, unless it's a neurosurgeon. That's a little different because he's a little bit more delicate with areas. Vascular is another one. You want to be slow movements. Ortho, general surgeons, they want to make sure they see it in their hands, right? Organize chaos during the process. This is your thing as it's coming down. Keep it wherever it starts. I'm so anal retentive. If I was working with you and suddenly you're like looking around, moving stuff, I would be like, I don't touch my mayo or the world will end. The reason is because if it's over here, let's say we put it over there and I normally live over here, I don't care if it's obvious, I'm in tunnel vision land. I'm like, yep, it was here a minute ago. And doctors then notice that. So you become very anal retentive. So you guys can break this down, you guys can break that down. But if you guys want to see their setup, we already said eventually like a midterm where we're going to come to kind of a basic midterm evaluation where you're all going to have a chance to do it a little bit. It's a basic open appendix case. Basic concept set up here. Whatever you're comfortable in any kind of approach we went over, I'm okay with. But that's all I really, guys. You guys want to take a look at it, that's fine. But if you're hot, you can break out of it. Anything that you did not have in your packs, you didn't have any light handles, you didn't have any laps or Raytech, make sure you have them in there, right? Because that'll help you out. Well, if you remember, I gave you that setup, but they didn't have it, so I put a variety of things up there. But in the future, do some research on the appendix, what goes on a mayo. I would say have it written out, so when you're ready to set up, stick it on the wall and set it up.
Here.
What goes on your mayo? 3 hemostats, whatever. You're going to go down the list and just throw it up there. It's better to start off with a simple
Yeah.
approach, even
I've been
though
with
you're
for
not
17
sure.
years.
Because that back
Yeah,
table is a
so-
base,
actually,
and then you can
yeah,
add to your
18
mail,
years.
right?
Yeah, I worked at Intercoastal Surgery Center,
I thought
and then I got contacted. They offered me, called me and asked me if I ever thought of teaching. I said,
I gotta leave
well,
too.
no, not really. Well, would you want to? I'm like, I don't know. So I kind of went and
Why do you gotta leave?
came in, and so this is where I've been since January. So
That's
yeah,
a movie.
I was at a level 1 trauma center, and then an outpatient surgery center
You got your homework?
up in
Or
Duluth.
you did that? You did that?
There, yeah, we had lots of trauma.
Does anyone
And
want to practice that? Or
we were the only trauma center all the way from Thunder Bay, Canada, all the way down into
no, I
central
just got
Minnesota.
one. So,
Yeah, so
when
I
you-
was in Duluth.
Is that bad? So hold your hand out, right?
So I was 2 hours south of the Canadian border.
So, man,
Yeah, it's crazy.
it just feels
Yeah.
weird in your hand.
We'd bring
So if you
people from
dangle a little
Canada.
bit, click it once. You just gotta make sure you're feeling their hands there.
Had to, because we were the
Instead
only
of like
level
you're
1
not
trauma
sure, you're
center.
just kind of like
So they didn't have anything. So there were in
So,
emergent cases.
have
we
this
got
where
them.
it's
So
kind of dangling like that
Mhm.
between your
Yeah,
thumbs like
'cause
that. You're just kind
we
of
were the
dangling
closest
out.
ones,
So,
Dangle.
like force
even though we were in
gump,
another country.
dangling. Yeah, it's good.
Yeah,
These are broken, Brad.
I know. there's a lot
doesn't
of-
matter.
That's good. Man, you don't have to be like, ah.
These are just
Make sure they feel it in their hands and you're holding on to it. That's all I'm asking for. Okay.
Brad, when you be here, sharps for my.
So, if you open blades, go in the sharp box, in the sharps box. Don't leave them in your sharps box because that's not the real world. Okay, just get.
No. Sandra.
We have tons of blades.
That's got to go in the sharps. So listen,
Infinity and
you
beyond.
never throw blades, needles, anything in here because what happens
you
is
doing
when
here?
they
What's going
change
on?
the garbage, they might get poked. So I mean, these aren't dirty, but in the real world, they'd be dirty. So you want to put them into the sharps.
You were a student here? Student? Yeah. What, when did you graduate?
Can we take it?
Oh, yeah. Yeah.
We'll wait till we get cleaned up and then
Carrie
we'll
was
take
in
it.
my class.
Probably.
Oh, okay.
Yeah. She told me to come work here and then took off on me. But yeah, Lisa was here when I first started, and her husband had a heart transplant. Or finally, just had it actually.
Yeah, that's what I heard.
Yeah.
So you're at Manatee now?
No, I'm at Doctor's here.
Oh, okay.
Oh, Jay up there. Jay and Scott. Scott, I worked with Scott for years at Short. Scott's great. Yeah. He was my preceptor when I was a student. Susan Kramer's still there, I think. Michelle.
Shortcuff.
Yeah.
Or no.
I can't. Yeah, I can't pronounce her name. She was here, student too.
Yeah, she was just. I think she was a semester ahead.
And then who else was there? Nikita was my student. I know. I love her to death.
Yeah, she's not a bad person. She's different.
Yeah, she's
That's
fun.
all.
So those ties, keep it. Just put it in a peel pack, and we can reuse them. Otherwise, I love taking. So I gave you a preference card, but make sure we have light handles in your pack. But if you don't have that preference card, we got to get it to you again. That was the first week I was in there because that's the kind of foundation we use.
Good job.
So yeah, so light handles, laps, Ratex, basic stuff that we do account with. So all this stuff should be quick.
I didn't know if you were supposed to pick that stuff.
Sometimes, well, if you have a pack, sometimes they're in the pack. So when I say laps and Ratex, just put them in your pack. So if you grab a basic pack, they'll be in there. But they can be they can be individually.
Wow.
They
actually work.
Actually, that tower in the back is probably the one you had. That's the old one. It works, but it's terrible. But.
Still better than at least the other.
Were you in the library? Yeah, so was I. Oh, what is the library now? What was,
It was just
our
the
lab?
library.
No, if they're open, we
Library
won't
was
keep them.
in the back, and then
We'll
we were
just
in
get
that
rid of
room.
that. I mean, if they're unfolded, the ones that are open that are not folded, we'll keep.
It's awful because we didn't have skills classes. We
Just
had
make
six
sure-
classes coming here periodically.
Yeah.
This is
Just make sure your tray gets put back into the correct
no, I mean,
tray,
it's
okay?
a class. You got to be
The correct Genesis
and you have-
container.
we have
So make sure that goes into one,
But we got to tear walls down. It's not happening. It gets
and
stuck
yours
in the-
goes into two.
And even this was a
Yes,
little.
please.